Carry on. So we're going to look at trimester 2 now. So trimester 2 is actually the most common trimester where women will start coming to a yoga class because they've got through the first trimester, they're starting to feel more confident about their pregnancy, they're generally feeling much better and they're ready to start something new. So we'll look at how many weeks, so approximately the 13th to the 28th week. Again, as I said, in different countries it can vary slightly. You can say the 4th to the 6th month. I generally don't like to go by month because if you look at 40 weeks, it's not 9 months. So it's much easier to understand where they're at if you ask them how many weeks they are. So as with all women pregnancies, it's going to be different. Some women will have a lot of symptoms, a lot of problems, and other women won't, but definitely some of the things that happen in trimester 2 are going to be pretty common. So one of those is weight gain. Now, the weight gain should be slow and consistent. I don't think there is any perfect weight that is recommended that a woman should be putting on each week or each month. It's going to be different for every woman. It will depend on her body type. It will depend on how much weight she's carrying already. You know, for some women, if they're very overweight and now they're eating healthily, they might not actually be putting on any weight because basically the baby's using all those fat stores and everything, so the weight will be quite consistent. Whereas a woman who was very underweight, who is trying to eat in a good way, not overeating, but just eating well, she may find that she's putting on more weight. And also the body naturally knows what it needs. So if we listen to the body, for some women, they will be hungrier. They will want to eat more because they need to eat more. And some women won't be hungrier because they've actually got enough in their body. So it's important not to get very specific with weight gain. It is really important that she is eating healthily, that she's not eating just for the sake of it, and she's not eating for what they call eating for two, and we'll have a whole lecture on that. But she should eat when she actually feels physically hungry, not just mental hunger. And the weight gain, you know, as I've said, it varies a lot how much a woman puts on. It is considered fairly normal to put on somewhere between 10 to 15 kilos is quite normal. But as I've said, for some women, they might not put any. For some, it might just be 5 kilos, but an average is around 10 to 15, or you can even say 8 to 13 kilos. Some women, they might put on a lot of weight. Some might put on like 20 kilos, which is a little heavy for most women. Some women have even put on more than that, like 30 or 40 kilos. And if they put on a lot of excessive amounts of weight, it can make it much harder for them to lose that weight later on. They could have put on that weight because they're not doing yoga. You know, I've known some women who basically didn't do anything in their pregnancies because they got a little bit lazy, or they didn't know what kind of yoga to do, or they had never done yoga before and they just didn't move around much. They weren't very active and they just kept eating, so they just kept putting on weight, you know, kilo after kilo after kilo. So, you know, ideally we don't want our ladies to be putting on, say, 40 kilos. So it should be the right weight for them. And it's not something we really need to be talking about with our students because that's the role of the midwife or the doctor. But if they are giving us, if they are asking us what are recommendations as per the yogic view, then of course we can share that knowledge with them too. But the weight should not be a big factor for yoga. Of course, it is another form. You can look at it as a form of exercise or activity, which is helpful for a pregnant woman, and also to become more aware of her body and what it needs. So it helps in that way. So yes, weight gain is definitely going to be there for some women. In the first trimester, I'm not sure I mentioned it, but for some women, they won't gain any weight in their first trimester. It's very normal that they won't gain any weight, and it's also very normal that they will lose weight because they're not eating very much. And that's okay as long as it's not like really huge amounts of weight. But in the second trimester, generally she will start to put on the weight. The energy is going to be increasing for most women, which is great because the first trimester she might have been feeling quite tired. She can also feel quite low, quite worried. But when she starts to have more energy, she feels much better. She feels better mentally as well. And she wants to start doing more things. So that's why I said often that's when a woman will decide to come to yoga because she feels confident, that she's got through that first trimester, her energies increase, she's interested to do things. So yeah, it's a good thing. Of course, some will still have fatigue, but it's not as common, nowhere near as common as it is in the first trimester. Generally, the frequency of urination is going to decrease. Nausea and vomiting is usually finished or decreasing. Of course, some women unluckily and unfortunately may have hyperemesis where they have that nausea and vomiting for the whole 9 months. That can definitely be really, really challenging for any woman. And as I mentioned, previously, people complain if they have nausea or vomiting just for 24 hours. So imagining to have it for 9 months is really a difficult challenge. So yeah, some women will have it, but it's definitely not common. Then the movements of the baby. Definitely in that first trimester, she's going to start to feel those movements. When she feels them will vary. If it's her first pregnancy, then generally she may feel baby move from around the 16th week up to the 20th week or the 21st week. If a woman has already had one pregnancy before, then she may notice the movements of the baby earlier on. So maybe the 13th or the 14th week. The reason it changes is because basically that movement is there from that time, but she doesn't understand that it's the baby. She thinks it's some gas, or something going on in there. She doesn't realize that it's actually the baby moving. So if it's her second pregnancy, she already knows what movements of the baby feel like, so she can understand it very quickly. For some women, they don't feel as much movement as others. A friend of mine hardly felt her baby for the whole 9 months. And for me, that was like such a hard thing to comprehend because the movements I felt were so strong, like from very early on, a lot of movement, always, kicking, elbowing, everything, like that film of the alien, the belly is moving with baby inside. But for some women, they don't feel that. And she was quite overweight and she did have her placenta laying just higher up and between there and the layers of abdominal muscle and fat. So the doctor did say that the reason for the movement was less was because of that. So some women don't have as much movement, but it is very common that a lot of women will be feeling it quite strongly. And of course, those movements are going to intensify from here onward. So they can become very strong later in the last trimester. The belly is going to start to expand. So for some women, even into the 4th month, their belly is starting to protrude. So that it's starting to come out of that pelvic cavity. And how much the belly expands will vary a lot. One of the things, the differences that you can see is that between a first pregnancy and a second pregnancy, generally the first pregnancy, it takes a little longer for the belly to start expanding. And for a second pregnancy, often the belly will start expanding earlier on. So she'll start to look a little larger. But generally, if you compare a woman who's had 1 or 2 or 3, by the 9th month, it's kind of the same size. It just started earlier to come out if it was the second or third pregnancy. And again, you don't want to compare women because every woman carries her baby in a slightly different way. Some women at 6 months, you look at them and you think they're going to give birth next week. And some women you look at and think, okay, is she pregnant? So it's important that you get her to write down how many weeks she is on her form, and you make a note of that so you always understand where she's at in her pregnancy, because you can never judge or get an idea just by looking at a woman how many months she is. So that's a bit about the belly. Then difficulty in balance as the center of gravity changes. So especially if she's putting on weight quite quickly, that center of gravity is going to be changing really fast, and it can be hard for her to, keep up with those changes. So balancing can be harder for some women. Then difficulty in sleeping can be there. This time it might not be because of the mind racing so much or the tenderness of the breasts, but it can be because the belly is getting larger. So especially if she normally sleeps on her belly and now she can't sleep on her belly, it can take a little bit of getting used to. And that's where you see all these different types of pregnancy pillows and all sorts of stuff coming out to help women to sleep more comfortably. Of course, we can use bolsters, we can use our regular pillows at home. We can give lots of options to help her. Constipation can be there for some. Heartburn, indigestion, flatulence can be there for some. Heartburn, especially later on in the second towards the end of the second trimester. Enlargement of the breasts is quite common. Headaches can be there. Faintness or dizziness can be there. Remember, these are all possible things that might be there, but not necessarily there for that woman. Nasal congestion is quite common. So having that postnasal drip, so that drip at the back of the throat. Bleeding gums for some women, especially if they're not eating very well. Increased appetite for many women, not for all women, but for some, they will have that increased appetite. And some women will also have cravings or aversions. Again, not all women will have those kinds of things. I've always felt from a naturopathic point of view that women have cravings often if they need something additional in their diet. Okay, I don't understand why one would crave for things like ice cream and pickles. To me, that sounds disgusting, and I've never had any I never had any cravings, but I don't know how anyone could crave that sort of thing, but people do. So there must be something in those things that their body is feeling that they need. But you do hear of cravings for inedible foods too, like what they call mica or mica, where they want to eat like chalk or coal or that kind of thing too, is there. So it is important to have a really well-rounded diet, and hopefully there won't be any crazy kind of cravings out there. Then there can be fluid retention. So that can be in the ankles, the feet, the hands, or the face. Is quite common, especially if she's not very active. There can be varicose veins. There's a tendency more towards varicose veins. So it is really important that she is moving enough, she's putting her legs up, and if she is standing a lot, then there is more of a chance that she might have varicose veins. Hemorrhoids, more of a tendency in pregnancy, especially if she is very constipated. She might start to have some mild breathlessness, especially if belly's getting quite large, and especially if baby is kicking up a lot into her chest. There can be achiness of the belly, so especially when the uterus is starting to stretch, everything around, the whole belly is basically starting to stretch. So it can be a little bit uncomfortable. There can be itching of the belly. So basically the skin starts to itch because it's also stretching, which can be quite uncomfortable for women. So it's really good to do massage of the belly. So using a nice oil, you can put some essential oils in as well, but of course you need to know the ratios very importantly during pregnancy. So it's good to get a ready-made aromatherapy oil unless you have a good understanding of essential oils, but certain oils can be very helpful for the belly to reduce itchiness and also to prevent things like stretch marks, and to help with the aching of the belly and also to build connection. So it's really nice to massage the belly every day and kind of talk to baby a little bit. Leg cramps are really, really common in pregnancy, so particularly at night. Also, the restless leg syndrome is pretty common in pregnancy too. So that's where she might be sleeping and then she feels her legs and she feels like she has to move her legs. So she moves her legs and then that sensation goes for a little bit of time. But again, she gets that sensation that she has to move, so she has to do it again. So it can be quite a problem for her to be able to sleep because she needs to move her legs all the time. So there's lots of asanas that can help with leg cramps that we're going through, and also a little bit of massage of the calves before bed can help, or even a bath or a little foot bath with magnesium salts can also help. Then we have back pain, which becomes a little bit more common in the second and third trimester, basically because of that curve in the spine is going to be increasing, the belly is getting larger, so it's pulling on the back. And clumsiness can also be there because of that change of shape of the body. So especially if she's not very aware of her body, she can like knock into things a little bit more easily. Then looking here, okay, we've got a nice picture here. You can see the baby growing from the first trimester, the second trimester, and then the third trimester. So you can see how baby is expanding. The emotions can still be quite unstable, but often in that second trimester, things are starting to stabilize a little bit more, especially because she's getting used to those changes in the hormones. And she also feels more comfortable within herself. You know, she's got through that first trimester. She hasn't had any problems, and she's got more energy. So usually she's feeling a lot happier and good. She might have frustration. So especially when her belly's starting to come out, but it just looks like she's putting on weight. But it doesn't have that shape of a pregnant belly. So sometimes she might be feeling a little bit uncomfortable or self-conscious because of that. She might have some forgetfulness. She might find that her concentration is starting to decrease. But she'll also feel the reality of pregnancy. A lot of women don't really feel that it's real until they're looking pregnant. You know, when they can start feeling their baby moving inside, then they're like, oh yeah, I really am pregnant. Beforehand, it's like, okay, yes, I might be feeling nausea, I might be feeling tired, but it still doesn't seem as real. So the reality of pregnancy hits, and that also means that there can be more thoughts about childbirth. Like, this baby's growing inside and it's going to have to come out at some point. You know, so some women will be a little worried about that. And then of course there can be the general worries and anxiety about baby being okay and healthy. So looking at the changes in baby, so by the 16th week, the baby is about 18 centimeters long and weighs around 200 grams. So it's lengthening a lot. The circulatory and urinary system are in working order. Okay, so baby is peeing into that amniotic fluid. Everything is moving. By 24 weeks, the baby is 31 centimeters long and weighing around 700 grams. The skin is covered in fine hair and protected with a waxy coating, and taste buds are forming. So that waxy coating is really important, that vernix that is covering, and you'll see when a baby is born, it's still having that coating inside, and that's protecting it against that amniotic fluid. Also, many babies, that hair is still there to some extent when the baby is born, and then it slowly comes out. So the top of the uterus is level with the navel, so you can see the 16th week, 20th week, and 24th week. So there's a lot of changes going on. You can see that little ultrasound picture. So usually the 19th or the 20th week is the time when that woman will have an ultrasound. Now, some women have an ultrasound earlier on as well. They might have it in the first trimester, in which case it will be an internal ultrasound, just to check the heartbeat. There's a lot of different methods of ultrasounds these days and ideas on how often to have them. Some doctors are giving ultrasounds all the time. I've known some women who are having an ultrasound every week. In Australia, it's recommended only to have the one ultrasound, sometimes two if it's necessary, but they don't do them every week. There are also some concerns about the safety of having very regular ultrasounds, you know, that radiation that is going there towards the baby. But the 20th week one is recommended because that's where they check everything. They're checking all the internal organs. They're measuring, you know, the sizes of all internal organs, all the bones, the length of, you know, the arms, legs, everything is measured and checked. So that is there around the 19th or 20th. So the end of the second trimester, the baby is about 36 centimeters long and weighs around 1.1 kilos or 1100 grams. The eyelids have opened and the lungs have grown enough to be able to breathe outside the uterus. Of course, help would definitely be needed, and it's still very, very early for a baby to come out, but there's been a lot of advances with small babies. So there is a chance that they will be able to survive, though of course there might be other problems there. And also the baby's ears have completely developed. So that's just a nice little picture to give you an idea of how the baby is inside. So looking at important things to remember. So because it's the second trimester, she can be more energetic. You know, she's got more energy, she's kind of excited, so there's a higher chance that she can push herself. And as we've talked in the guidelines, we talked on the relaxin that is there, which makes one a little bit more flexible. Finally ready to do things, so she might overdo it. We avoid prone asanas because of compression of the belly, because the belly is going to start to protrude. And we also take care with supine asanas. So for some women around the middle of the second trimester, she starts to feel uncomfortable to lay on her back. So that's where she may lay on her side, she might stay at a 45-degree angle, or she might just do all her movements from sitting and standing instead, or, you know, from the cat position. So as I mentioned earlier, every woman is going to be different with how comfortable she feels laying in supine, and especially if the belly is getting larger, there's a higher chance that she's going to feel uncomfortable earlier on. The next point is it is the start of yoga practice for many, many women. Many women who have never done yoga before, they get pregnant and they think, oh, now's my time to do yoga. So that's a really good thing, but it also means that we need to educate them on how to practice in a safe way that's going to be supporting and respecting and loving one's body. And I've already mentioned it is the most common time that a woman will start coming to class because it's the time where she does feel most energetic. Some women do come in the third trimester, but usually they come in the third trimester because they want to know techniques that will help with labor and birth. So what to focus on in practice? Well, balance. So balance on a physical side, definitely, because one can lose a little bit of balance and coordination, but also for mental balance, mental peace, mental health, to have good posture. So especially if there is a tendency towards back pain, so taking care with and understanding how one should be standing, sitting, all of this. To nurture and help the body as well. So taking care to look after the body, any kind of problems that might be there, to do practices that are going to help, but also practices that will prevent any other problems coming. So looking at the yoga practice, so leg and pelvic strengthening. So we do the leg strengthening basically not only to tone the body, which of course is good, but it's also important to have strengthen the legs not only for labor, because she might be spending a lot of time standing up or moving around, and then also for the postnatal period where she might also spend a lot of time walking around holding a baby. So strengthening of the legs in that way, strengthening of the pelvis, of course, because we don't only want flexibility in the pelvis, we also want it to be strong. And especially a woman who is becoming too flexible in the pelvis, she needs that strengthening effect too. And of course, we want to have nice, strong, flexible pelvic floor muscles. So pelvic opening, coordination, strengthening of the back, and also back pain prevention. So there's lots of practices that we can do which can help prevent back pain and also relieve back pain if it's there. So looking at pranayama, so we want to do pranayama that is going to help increase the prana, which all of the pranayams are doing, still for relaxation and introversion, so stress and anxiety, to strengthen the lungs as well. And we can start practicing more pranayams which will be helpful for the time of labor, and also practices that she will be able to do postnatally as well. So there's a lot of pranayam that is going to be very helpful. Then neti, so jal neti, she can be practicing if she wants to be doing that. So if she's feeling stressed, if she just wants to make sure that her sinuses are really clear, she can do that. And yoga nidra, of course, the pregnancy yoga nidras are going to be the best for her, or putting in a visualization that is especially needed for her during that pregnancy. All sorts of meditations can be done. If she has started a meditation practice in her first trimester, then she can be continuing with that meditation, or she can try different ones. And of course, you can put all sorts of visualizations into our shavasans as well. Mantras, she can be continuing with any kind of mantra practice that she has, or just Om chanting or Gayatri, Mahamrityunjay. It might be that she does Om chanting before she goes to bed at night, which is going to be very helpful for her sleep and also for just calming her mind. Or it might be that she gets one mala and she does, say, a round of Mahamrityunjay, or even more than that, every day, whether it's in the morning or before she goes to bed at night. So it's just another form of meditation that she can be doing. Then of course Mula Bandha is there, so still remembering that it's not only about the contraction, it's also about the relaxation. So that's Mula Bandha, and we can apply Mula Bandha into the different types of asanas. It doesn't have to be just sitting there and doing Mula Bandha. So that's a good thing. And Ashwini Mudra. Ashwini Mudra is generally we practice it in Sarangasana, Ashwini Mudra, but obviously in pregnancy we're not going to do Sarangasana, the shoulder stand, but Ashwini Mudra is where we are contracting the muscles of the anus. So we're contracting and relaxing those muscles. So it is different to Mula Bandha. Mula Bandha is contraction specifically of the vagina. Obviously all those muscles are getting contracted at some point, and but it is important to understand that they are different. There are actually quite a few practices in the pelvic floor. You've got Mula Bandha, you've got Ashwini Mudra, and you've got Sahajoli Mudra, which is contraction of the urethra. It's very common that everything contracts, and it's also fine, especially during pregnancy. There's more stress being put onto the pelvic floor, but it's important to know contraction and relaxation, and all of that is going to be helpful. So those are some of the practices that we can be doing in the second trimester. Now, many of those practices, or basically everything a woman is doing in the first trimester, she will mostly be able to do in the second trimester, just taking care of supine asanas and obviously not having prone ones. Hariom.